Hi, this is Joe Mullings from The Other Side. You're going to see a little bit of a set change today. We've got some technical challenges in studio, but as usual, the team pivoted. And I have to thank my guest today, Greg Lucier, for pivoting with us and having incredible patience as we got him from San Diego. Greg, how are you?
Good morning, Joe. How are you today?
I'm doing well, and I appreciate you taking time out. I know you're super busy. Greg is the Chief Executive Officer at Corza Health, and previously was Chairman and CEO of NuVasive. And it's great to have Greg here this session. And I was very, very interested because Greg has shared some insights online in regards to what's going on right now, obviously for the patient first, and also some of the collateral consideration we need to take into mind as we move forward. It might be weeks, it might be months in this. So, Greg, I want to drop it there for you and have you expand on that.
You bet, Joe. And so I'd first just say that we Americans absolutely value the sanctity of life. Every life is valuable and worthy of our efforts to save, but we're also pragmatic people. And we understand that we can't possibly save everyone from disease, infection, or accidents. And so we're left with this very difficult choice right now in a very difficult situation with the coronavirus of just how far do we go in terms of limiting the spread versus how far do we go in terms of potentially damaging our economy for a generation. And as you referenced, that's the piece I recently wrote that just got published in the Wall Street Journal and other places about this trade-off. My own humble view, Joe, is that with this lockdown in place, we now need to set a date. And I was very encouraged that President Trump has started that conversation to set a date. Ironically, I also said a week ago, probably by Easter, that we put in place all the critical measures and actions in place to limit the spread of the coronavirus. But then the rest of us, we've got to get on with our lives and do what we do every day, which is productive work.
Yeah, and when I first saw that piece, I was made aware of it by another executive in the industry, and I read through it. And previous to that, I too was wondering when is the other side of this going to be addressed from the economic perspective? Because I don't think we're going to get a clean cut. I don't think this is going to be an easy exit ramp. And I certainly am not, and as you've pointed out, I'm not in a position to make the decision of when is right is when is wrong. But it's curious to see the reverb that's coming out in the industry right now, in the medtech industry. And I brought up NuVasive earlier because, that's a very large organization, a very large market, and the reverb in the industry on clinical trials, saving other people's lives, on healthcare in general, and being impacted across the board. I think the industry and the world is raising that dotted line that everybody refers to with added ventilators, other beds, protective personal equipment, and we're doing everything we can. However, I'm wondering what your thoughts are and when is that crossover occur, and are you going to look for specific guidelines or winds to shift? What's going to be your trigger on this?
Well, I think there's a couple of things that we've got to watch out for. First, we've got to make sure that the testing regimen is in place across the country to meet the demand. And certainly by Easter, that should be the case. And so we should feel good about testing. Now, we'll come back to testing in a moment. But the second thing we've got to do is, and we are, mobilizing the healthcare industry to provide those critical supplies, ventilators, masks, and the like. And I've been checking in with my contacts, and it seems as well that by mid-April, we'll also have a framework in place where ventilation technology is in the most acute areas needed to address the most severely impacted by the virus. The last thing I would say, though, because you brought it up, is that what's the overall theme? Because I agree with you. I think we're going to be dealing with this for some time. And the theme, in my view, to kind of steal a page out of healthcare is we've got to go from an acute setting, an acute response like we are right now, to a chronic disease management in the next few weeks or so. And I confidently believe we can do that as a country, as a people, and certainly as an industry to provide that chronic support for this ongoing battle with the virus.
You know, the move that the U.S. government made, every great decision has a timeline on it. And you can make a great decision, but as you take that longitudinal timeline downrange, that great decision may not be a great decision anymore. And I think that's what we're running into right now, that we monolithically stopped our country. And then it's time to start maybe looking at verticals on a re-entry. What are your thoughts on that?
I think that's also a very good metaphor to go from a horizontal lockdown to a vertical approach to quarantining, addressing this chronic approach that we have to now have to battling the virus. You know, if you look at the facts on the ground, it's clear that this virus does not do well in warmer climates versus colder climates. And that's why you're not seeing the larger outbreaks of the disease in San Diego, in Houston, and other places like that. And so I think we're very right to do, as you just said, to move to a vertical approach where certain areas can get on with their lives, still battling the virus, and other areas like New York are going to be more acutely affected, and we need different measures there.
Yeah, and I think you just pointed it there, different measures. And so the lockdown made sense, and evals based on geography, based on data. And then, interestingly enough, yesterday, and this is, I have not heard chats about this in the U.S. system yet, and I find it confounding. We keep on comparing our response to Asia, and then we are comparing our response in Italy and in France. Yet in Asia, what they did, and I have not seen this yet here, is they were able to trace the patients who were sick. And in Israel, I had a friend on yesterday, it was probably a friend of yours out of TriVentures, Michael Geva and Peter Fitz. And they in Israel, they were able to track any patients that were ill within 2 meters using the iPhone and the cell phones to see where they were, and then reverse engineer that and SMS text that to other people, anonymized, that were saying you were within certain 6 feet of a patient who tested hot. How can we not have that here in this country, or even an analog function on tracing?
I completely agree with you that the level of sophistication that we have had for a test, trace, track regime is woefully behind where everyone else probably is, certainly South Korea and Israel, as you point out. And when the final day of reckoning comes, that we look back on our handling of this crisis, we do have to hold people accountable. The Centers for Disease Control, an organization I've known well through the years, is funded to the tune of billions of dollars a year. They had one job to do right. It's this, and we're looking at a colossal failure of epic proportions. But I agree with you, and that's why I wanted to reference back on testing. While in a few weeks we'll have plenty of tests available for our population, we still will not have in place this tracing and tracking mechanism you described. It is so relatively easy to execute with our great technology here in the United States. It is just a failure of will on the point of our appointed government officials to do so.
Do you think the conversation enters into quote unquote surveillance or civil rights and privacy? And when does that line become blurred based upon a threat that we have and we really are at war?
I love the question because I think it's a very appropriate one for our country, which prizes itself on individual freedoms and privacy. And yet I also believe through time, we've always done a wonderful job as a country driving the right balance at the right time. Whether it's in wartime or in a war against a virus, we clearly have to move that line closer to more state control and surveillance. And then we have to also have the flexibility, as we do as this country, to snap back to the normal state. And I think people like you and me, government officials that are very acutely sensitive to this issue, will always make sure that we're bringing that line back at the appropriate time.
And I find sometimes that those who wear the tinfoil hats would say that it's going to be overreaching, or once you let that cat or genie out of the bottle, it never gets back in. And what would be your thoughts upon that?
Well, if you look at our response to 9/11, and I think this is an appropriate metaphor here, is that we were completely unprepared for that travesty. And when the dust settled and we look back, we made appropriate changes in our country. One of them was the Patriot Act that allowed a deep surveillance of phone calls and data and otherwise. And you can see over the course of the next 15 years, we did very intensely monitoring. And then more recently, the Patriot Act has been modified to back off some of those controls. I think the same thing has to happen here. We need a correction. We need in place a framework and a regimen to make sure that the next virus that comes, we're prepared like Israel was able to do, and then we'll see how we do with it. But I'm confident we have the smarts as a country to constantly evolve our protections as necessary.
Yeah, I would tend to agree with you on that, given previous experiences. I want to go back to the economy for a second, because we addressed that strongly and certainly are asking the appropriate people to keep an eye on that. Any recommendations on how we on-ramp that, besides just limiting the social distancing, the small business owner being crushed, even the medical device industry that services, that you and I know so well, servicing those who are quote-unquote elective surgery or elective care? That means cancer patients. That means surgery on children. So what are your thoughts on that on-ramp?
Yeah, great question. So in my piece, I say that there are very important lessons here from this current lockdown around social hygiene, social distancing. And I think they're going to have to remain in place until we have a therapeutic and vaccine approved. Less handshakes, more bowing, keeping our distance like the Japanese culture tries to tend to do. And that's all good. And I think, again, that'll have to be in place for a while. But now we quickly have to pivot to allow these businesses to start opening back up. And it seems to me that on a local basis, municipalities can make those appropriate decisions. But back on your point about elective procedures, once the hospital systems in a city are prepared for what a wave of infections could be into the ICUs, and they can do the modeling, then they should have the appropriate confidence to open up the rest of the hospital for those other patients with their other disease factors. And I think we've got to get on with that, like I say, by the time of Easter, where these appropriate trade-offs are now being made.
The leadership in the country right now, I'd like to go there a little bit. And, certainly you have, Trump at the top, and then you have the CDC. And I've heard from others on the CDC side that they've been ringing this bell for a long time and have had cuts back to their massive budget as well. Could anybody have seen this coming from a political perspective, or was it ignored, or was just the magnitude of this not imaginable?
I love the question, because if you start with your last point, it was, unimaginable. I actually think 9/11 was unimaginable. I think we all stood in shock when we watched those airplanes go into the World Trade Center. We just couldn't even fathom such an action. This is different. This is different because we've had warnings through time. We've had MERS and SARS. We had Bill Gates in 2015 warn us that the real issue was a pandemic coming. And we all know we had about 4 months warning looking at Wuhan and what was potentially coming. No, this is different. This is not an issue of funding. Go spend some time looking at the funding for CDC, and we can talk about relative funding, but on an absolute basis, billions of dollars were flowing into it. This is a larger issue that I'm going to talk about in coming days around competence, and that in every other sector of our society, competence is corrected and great competence rises to the top. Not in government, though. And I think we're bearing the price of that now for not having the confidence in the CDC, among other places. And it's a larger conversation to have.
Yeah, and that's going to be a fascinating conversation, because I think you're starting to see cracks in society that people for a week or 2 weeks or even 3 weeks, depends on where you are in the country, being sequestered and kept inside. And after a while, patience is going to start to run out. And especially as Americans, we don't have a lot of patience when it comes to our personal freedom and finances. It just the country's just not been built that way. And so I think there's going to be more blood in the streets sooner than later on this, and it will be interesting to watch on how the country responds from an accountability perspective. And are we going to wait to the end, or is it going to start now?
I agree. I agree. You can already start to see the conversations taking place where there's a lot of frustration and a lot of desire to have that conversation about, was this the best way? Were we best prepared? Who's at the top making these decisions? And how real are they in their authenticity in making their decisions, or are they grandstanding? All of this narrative is coming out, and I think it's yet to come in terms of what changes we're going to demand as a society.
And I think what we've got to do on this, on the people that are going to look for the accountability, we've got to give permission that we run this parallel path. The seeking out of accountability does not come at the expense of treating the patient.
Absolutely right. We can do two things at once. We've always done it as this nation, as having great conversations and debates while we do the things that need to get done.
Absolutely. Greg, I know you're very busy. I do appreciate your time on this. Is it okay if we reach out to you as this situation continues to evolve and the conversations become more and more real about getting back to whatever the future of normalcy is?
I look forward to continuing the conversation, Joe.
I appreciate it, and I appreciate your time. And listen, stay safe out there in San Diego, and again, all the best to you.
All the best to you. Thank you.
Thanks. This has been Joe Mullings with The Other Side.